So this is where we are. As Matt had mentioned, we're in Green Bay, Wisconsin, the land of beer, cheese, and the Green Bay Packers. And as a population health company, we definitely have a lot of work to do here in our region. The next slide shows an image of Lambeau Field. Many of you are well aware of football in the United States. And the Green Bay Packers is our healthcare partner in our community. And we work very closely together, really, in inviting, engaging, and empowering our community to lead their healthiest lives. So this is just a description of Bellin Health and who we are. I won't read all of this to you, but basically we are a fully integrated health system serving northeastern Wisconsin and the Upper Peninsula of Michigan. So we have the full continuum of care for the people that we serve, ranging from acute care to behavioral health to clinics and specialists and primary care. We are a clinically integrated network. We have a college and a very extensive footprint across the communities that we serve. One of the things that I think is important to share in the next slide about us is kind of how we identify ourselves. So you might have cued into the fact that I talked about Bellin being a population health organization. So at our core, healthcare is our core business, as I described to you on the slide before. But if you think about the analogy that I like to use is our pronoun, we identify ourselves as a population health organization. And what that means is that we wake up every day thinking about the communities that we serve, not only through the lens and eyes of individuals, but also, and we are very much a quality improvement minded organization. And I think you will see that today as Jody highlights the work that we've done with some of our employers and community members.
Can I ask a question here that I really like something you said there? How do you work to co-design what you do with your community? I thought that was very intriguing because that definitely hits alignment. So how are you co-designing with your community? That's an interesting concept.
Well, Jody's going to give you some very specific examples of how we do that. But at a high level, our mindset is co-design. We don't do things to people. We do things with people. And in every instance where we are partnering with anyone really in the community on an individual level, we talk about things like what matters to you. We don't like to focus on kind of we have to focus, I don't want to give the wrong impression, on those types of systems of measurement that come to us through payers and government and things like that. And of course we pay attention to those, but what's really even more important to us is from an individual level, what matters to you, from a community level or an employer level, what matters to you. And when we listen and when we understand the needs of unique individuals and companies, we are able to work with them to co-design a solution that meets the individual and needs of that specific. So how we think about it, and again, I think you'll see this reminiscent of aspirational healthcare, is we view it as a comprehensive approach that leverages that cooperative power of individuals, healthcare systems, and communities in order to equitably and affordably optimize the health and well-being for everyone. And that's how we think about population health.
Well, thank you, Andrea, for setting the stage and kind of grounding us in those population health principles, which we feel are so important. But this next slide really, to me, highlights it all. It's really, to me, how we do our work, and it's that commitment that we make to all of our patients and all of our communities, and even our internal and our external partners. And we call it the Bellin Promise. And it's stated, I will know you, I will show you respect, I will go with you on your journey, and I am here to help. And you can see here in this slide, there's a little pinky swear going on there. But really, I feel it's way beyond a pinky swear. It's more of a promise and a commitment that we make as an organization. But what I want to point out on this slide is how we're starting at ground zero. We start with defining the population and really getting into knowing them. So think about that Bellin Promise that I just shared with you earlier. I want you to think about that Bellin promise as we go through all of these slides and see if you can pick out which pieces of the promise I'm referring to. And this is the total health model. The total health model for population health helps us to achieve those population health outcomes, those positive health outcomes at a lower, more affordable cost for all. And you can see how it aligns with our population health definition. In this model, to us, depicts how we deliver on that triple aim or quadruple aim, or maybe even whatever, quintuple aim, and the Bellin promise. To me, this is somewhat of a pride slide, and some people might call it a bragging slide, but I think at Bellin, we do take extreme pride in our partnerships that we work very hard to build. With this, we within business and community health, we have over 1,800 occupational health clients, several hundred employer clinic and employer health partners. You can see the level of visits that we intake each year, as well as the number of lives that we help to manage at an affordable cost. So we often say that we're saving lives before they know they need saving. We can't do it without our communities. And as we move into the community section, I think it's important to recognize how important community engagement is, and it's really essential. We want to learn about the issues that our patients are trying to address where they live. We want to learn from our communities, and certainly we want to leverage that cooperative power that we can build with our communities. So I have the honor and the privilege of leading an amazing team of Bellin community ambassadors. Now, the term community ambassador doesn't just refer to they're out there to promote Bellin. What they're really there to do is to bring forth the voice of their communities. I have 28 very amazing community ambassadors, and I tend to get like a little emotional because I'm so proud of the work that they do. This work spans across 12 counties in Northeast Wisconsin. They're sharing their strengths, but also their lived experience. We know that that's so important to have that lived experience, and they're doing it where they live. So these are Bellin employees practicing where they live on issues that matter most to them with the people that they care about most. These ambassadors engage in that shared vision. So bringing people in to that shared vision of our people in our region will be the healthiest at every stage of their life, and our communities will thrive. And that's what we're seeing. But ultimately, this data is helping us to understand and know our populations. We analyze it, and then we do outreach to where people are at with the ultimate goal of improving those outcomes. I often ask, is the problem within the individual or is it within the system? And sometimes as an organization, we do have to look in the mirror and say, what do we need to change in order to meet the needs of the people who we're serving? So I mentioned that mammography example. We're looking at extending our hours. We're even looking at the feasibility of bringing a mobile unit on site to an employer so that folks can get their mammography screening done. And that to me is how you can save lives, because we all recognize the importance of understanding. If you look at just the bottom of this little person here, only 20% of what influences a person's health and well-being is just really healthcare, right? There's so much, so 80% falls outside the walls of the clinics and the hospitals into other areas of people's lives. We know that in healthcare, it's important that we look at those other areas. So it might be with data collection, but I feel so strongly, and I know Andrea does too, about that transparency of reporting. We need to share this information with our partners, with our community partners, with our employer partners, and then partner together to influence the social determinant gaps that we're having. The center of our total health model is around navigation. So this is, I will go with you on your journey. So think about that Bellin promise. We have to consider with our partners, what does our invite look like? How are we inviting people to our door? Is it an actual door? Is it a digital front door? What is the ease of access? So do folks have equitable access? Are we easing their way into our system, or are we creating barriers? I think we're always thinking about these things as we partner and work with our partners.
if you take the approach that you're one size fits all and that you're going to go out and sell to employers, that it just doesn't work. You have to understand the uniqueness. A shipbuilding company is going to need very different products and services than a health system that has young nurses of childbearing age, as an example. And I think what this team has done such incredible work on is designing everything in a way where they sit down with the employer, they look at the data, they understand the uniqueness of the population. Maybe this is a business that's in a small community that has water safety issues. Maybe, there's all these innuendos at the community level, at the business level, and then the team co-designs the solutions based on what that employer needs. So it looks very, very different from company A to B to C, based on what's installed.
How do you work with providers that are outside of Bellin? Is there a way to collaborate within what you're doing?
Well, the first two words in our mission statement are in partnership, and we truly live that. I mean, I can't. It's hard for me to think of things that we do outside of leveraging relationships and partnerships. And we even partner with our competitors. In certain instances, if it means, doing the right thing. During the pandemic, that was a great example of partnering with one of our major competitors in public health, just in a way to make our community a safer place. So I would say we partner with competitors. We partner extensively with community organizations. And an example of that would be right now work that we're doing with our refugee community and an organization called COMSA. Knowing that our model in Green Bay, Wisconsin, in the U.S. on how we define primary care is not how the Somali community, Green Bay, defines their primary care experience. So we will work with different partners to co-design, in that particular example, a culturally welcoming and honoring primary care experience that will be unique to the population.